the thought that there is hope for not only frontline workers to be more protected against the virus until everyone can get it, plus the entire population of the world being able to get it. And for my grandparents and my family, it is a good feeling. Hi, my name is Victoria Keach. I am a certified intensive care nurse currently in Arizona. The vaccine was talked about within the nation that was being prepared to be released. That the emergency distribution was being started early December is when I first started hearing talks, and the management at the hospital that I'm at let us know that there would be a link to access to register. And through that link, there was many questions that asked you, are you a frontline worker? Do you work in a hospital? Do you work in a clinic? How old are you? Do you have any pre-existing conditions? And it took about a day until I got my results that I was eligible as an ICU nurse working aerosolized procedures several hours a day with coronavirus patients, and then was guided to a scheduling section of an app, and then you chose both of your vaccine days, and they were 21 days apart. Everything went flawlessly. They did an incredible job. So I made some friends there too, because it was there for so long. A lot of volunteers were there. There was a volunteer that is also a nursing student instructor, and her name was Bev, and we became good friends. I had a bit of a reaction. It was the body adapting to the not live virus within my body and recognizing that something is there that should not be, and then preparing my body for the next time that it is. I had a little bit of arm pain, but it wasn't too substantial. The following 2 days after, I just had very strong sinus symptoms. I just felt very stuffy. My ear felt full, kind of like a sinus infection. But it only lasted a couple of hours. I took some decongestant. I took some Tylenol. I don't think I had a fever. I had chills, but it was gone within a couple of hours. It wasn't like a long, drawn out thing. I really don't think I had fatigue either. I think it was just those symptoms that I had experienced. And then some people say that the second vaccine is where you experience more of the symptoms. So it'll be interesting to see what my reaction or response is to that one. I did not have any concerns getting it. I do have a sesame seed allergy, and when I went for my vaccine, I brought my EpiPen, and it sounded like a lot of people that were having reactions, they were drug related. So if you have an allergy to antibiotics, they were saying that can cause a reaction in some people. So if you do know that you have that, definitely make that aware to the people administering the vaccine to you. And when I went, I was in a separate line. It was all drive-through. It was an incredible experience to see everything the way that they had organized it and planned it. It was pretty awesome to experience. And I'm hopeful and excited that more people are being able to get the vaccine. In Florida, I know that they are already distributing it to the elderly population, which is just wonderful. And when I called my grandmother and told her that I got the vaccine, she started crying. She's like, I've been so worried about you. And it just felt like a time of hope. I'm looking forward to better days for everyone. And to think that we've been almost in this pandemic for over a year now, and things have not changed. We're more smart with how we approach it, but we're still tired. So the thought that there is hope for not only frontline workers to be more protected against the virus until everyone can get it, plus the entire population of the world being able to get it. And for my grandparents and my family, it is a good feeling. To anyone concerned with getting the vaccine, I absolutely respect your concerns, and they are valid. If you need anyone to talk to that's been through it, hi. To anyone in the public, thinking about getting the vaccine, I think it's something that is going to ultimately help the population, or us to be able to go back to our new normal. I think that's the only way that this virus is going to go away, unfortunately.